Yep, come on.
Here's the mail, it never fails. It makes me want to wag my tail. When it comes, I want to wail.
We just got a letter. We just got a letter. We just got a letter. Wonder who it's from.
We've got a lot of mail.
Oh, we do indeed. This is probably a handful of weight comparable to gold because we have mail today. You guys delivered. And with that, our first piece of mail is from Mike. And Mike says, "Good morning. 1. We are going to add Susan Schumacher to the birthday list. Happy birthday, Susan. You are on the board for today for the Daily Spin the Wheel and for Merle Fest. And 2, looking for a 10 by 10 straight leg canoe frame, would buy complete if price is right. So if you have a 10 by 10 straight leg canoe, a canopy frame, excuse me. I think I said canoe, but I meant to say canopy. I don't know. My brain's not here today. But if you have that 10 by 10 straight leg canopy frame, let me correct that. For the good price, you can give a call or a text to 704-902-1131. And you could ask for Mike. He says, "Have a blessed day," and have a blessed day to you too, sir. Second, our friends Scott and Joyce Phillips, they say, "Anna Spear has her birthday today," with 2 little party popper emojis. Thanks, and have a blessed day and weekend. Have a blessed day and weekend as well, Scott and Joyce Phillips. We enjoy hearing from you. And of course, have a happy birthday, Anna Spear. We have you on our board for today for the spinning, for the drawing. Also, we have from Randall a boat for sale, a 2005 Stingray LX185 ski boat. It is clean and in good shape. It does run, but it will need a visit to the mechanic. So you could give a call for more details to 704-252-7950. And finally, we have a message from Kevin. He is looking for a lawnmower repair. I need someone to replace a pulley on an older model Toro Zero turn lawnmower deck. Also, they need the blades sharpened. I can normally do it myself, but I am getting to where I can't bend like that anymore. ... Please text me at 704-901-6864. So if you can give Kevin a hand, that would be wonderful. And speaking of not being able to bend like that anymore, we have a guest in the studio with us today. That was the perfect segue. That could not have been the most perfect segue. Because also with the mail, we were delivered Dr. Jessica Roberts from We Care Chiropractic. How are you this morning, Dr. Roberts?
I'm well, Kayla. Thank you for having me.
Yes, I'm so happy you are here. So for the people who don't know you in the area, can you tell us a little bit about yourself and what led you into chiropractic care in the first place?
Okay, well, I am a chiropractor in Mooresville. I'm certified in adjusting pregnant women and children. I've been a chiropractor since 2022. What got me into this is because when I first got into undergrad, I wanted to be a doctor and didn't know what kind of doctor I wanted to be. But I was already CPR certified from past medical experience, and my uncle had a heart attack in my living room, so I did CPR on him. And when the ambulance came to get him stabilized, they said whoever resuscitated him, saved his life. So it kind of put a spark in me to try to look for something that I can do with my hands to try to help people.
Wow, that is special. And thank God you were certified, one, and thank God you saved him, because that is absolutely a special story to tell. Now, for your practice, can you tell us about We Care Chiropractic? I know that you said that what you specialize in, but who are you really helping in your day-to-day around here?
Well, I'm hoping to helping everyone. Right now, I have more of an elderly population because they're seeming to gravitate towards me, and I love it. But I also want to, since I do have a love for helping everyone, and especially adjusting or taking care of shoulders, elbows, and knees, I would like to take care of more improving the health of people in the community more in the Lake Norman area.
Okay, love it. And I know that you said specifically about like pregnant women. How does your care for pregnant women differ from someone who is like elderly, for example? Like, how does that care change, like the care plan for them?
Well, when it comes down to pregnant women, is just making sure that their pelvis is well stabilized as their bodies are changing for the baby. Compared to someone who's elderly, you have to consider their limitations. And the goal for that would be to more make sure they have enough balance overall in their spine, so to prevent falls and increase mobility. Whereas with women, is more focused on making sure that the hips are more balanced and well stabilized, so they can handle pregnancy and labor.
Right. That's actually really interesting because I've never thought that pregnant women would need to consider chiropractic care because I feel like people tend to think, and this was a great segue into my next thought, that people tend to think that we only need chiropractic care when something is already wrong. So, like if you have an accident, a fall, any type of injury, or just chronic pain, would you say that that's the way it should be, or should they come in for preventative care, or like how do you feel about that?
Well, just like when you go to the dentist, you don't go there because there's a problem. You go there because you want to make sure that your teeth stay healthy. And if there is a problem, that is easier to take care of versus someone who has never been to the dentist. And then after years of dealing with pain, the pain is to the point where they can't handle it, then they go to the dentist and then there's more things to intervene. So I'm not saying that it's wrong to go when there's a problem, but it just makes it easier for you overall if you can do things preventively, but versus doing it when something has occurred.
Right. That does make a lot of sense because again, even someone like me, it's like, I slouch a lot and I do have the back pain and I play guitar, so I get that shoulder pain and carpal tunnel and stuff like that. So I understand like also that might be something that like if you are a laborist or if you're on your feet all day or if you're heavy lifting, it might be great to consider visiting a chiropractor in advance, so you're keeping yourself like loose and free flowing so you don't actually hurt yourself, so you don't have a bigger problem essentially.
Yes.
Okay, that's good to know too. What are some common issues that you are seeing right now in your care?
Sciatic pain from sitting.
Yep.
A lot of people in our society, they like to sit, which is fine. It's just more our bodies aren't meant to sit all day, so that just irritates that nerve in the lower back region. And those are, a relatively easy fix for a chiropractor. But also when it comes down to, like right now, I have a lot more elderly people right now I'm seeing, just establishing their spine being straight so that they have less of the imbalances, because the biggest thing when you get older is worrying about falls, because heaven forbid you have a fall, your body kind of just goes downhill from there.
Yeah, and especially I'm assuming if you have like degenerative bone issues and stuff like that, that would probably lead to more problems too down the road.
Yes.
All right. So with that, we are coming up on our next commercial break. So when we come back, we will speak with Dr. Roberts some more. We have Spin the Wheel for the birthday and anniversary prize and for Merle Fest. So we'll be spinning twice a day. Well, I think we'll have, if you're okay with it, we'll have Dr. Roberts spin the wheel today, if that's something you want to do.
Okay.
But in the meantime, just sit tight and we will be right back.
From
celebrate. There's a party going on right here.
Oh, there is a celebration going on indeed, because today is a big day for the world famous home ad show here on WSIC. We have Spin the Wheel. We're also doing that additional bonus drawing for the 4 tickets to Merle Fest happening April 23rd through the 26th at Wilkes Community College. So, Dr. Roberts, if you would love to spin that wheel right there, we're going to give it a little countdown of 1, 2, 3, and spin. I don't know why I counted down that way, but all right. It looks like we have Susan Schumacher for the winner for today. I had to count it because I have a little system here, but I had to count it. We have Susan Schumacher. Happy birthday. And of course, we are also celebrating Patsy Dalton, Dylan Dishman, Simon Edding, Melvin Nesbitt III, Anna Spear, and Lori Thorne Sutton Haycox. Happy birthday to all you lovely people. And we are going to spin the wheel one more time for that Merle Fest giveaway. Okay, and whenever you are ready, Dr. Roberts, we're going to do a 3, 2, 1, and spin. All right, we have Miss Patsy Dalton as our winner today for that For Any Day Pass to Merle Fest happening April 23rd through the 26th. Congratulations, Miss Patsy. And again, happy birthday to all of the people who are celebrating today from WSIC and the world famous home ad show. And if you didn't call in, if you didn't send in an email and you are celebrating today or this weekend, if you have that birthday or anniversary, we are still wishing you a very happy birthday, a very happy anniversary as well. And celebrate responsibly. Have a good time. And we're going to come back to Dr. Jessica Roberts from We Care Chiropractic. We were talking a little about her practice and about kind of what steps need to be taken to get yourself into chiropractic care and who needs chiropractic care as well. But to kind of rope back into that conversation, for someone who's never been to a chiropractor and might be a little unsure about going, because I know some people might be like, the pain will go away, or I'll do something. You know, I'm kind of a victim of this, is homeopathic and trying to do things at home, like stretches and stuff like that. So for someone who's a little unsure of chiropractic care or visiting, what is something that you would say to them to assure them that they are in good hands and that chiropractic care is a valid choice for them?
Well, first off, stay away from social media.
Absolutely.
Try not to Google. That's with everything. Don't do it, because then you'll go down a rabbit hole that's not necessarily what you need. And then, of course, do your research. Chiropractic care is evidence-based, so it's not something that we just made up. And if you are unsure, go to like your nearest chiropractor and research them and see how well they are handling their patients, see what their patients have to say about them, and look at their website and get a feel for them.
Okay, love it. And then a question that just came up to me. What is the difference in, if you can speak on this, like what is something different in your experience in chiropractic care that is different from someone who does, let's say, like occupational or physical therapy? Like, when would someone want to come visit you versus them, like a physical therapist, for example?
Well, I wouldn't say necessarily it's a choice to say them versus me, because to be honest with you, the more people in a patient's corner to help them out is just the best way they'll get a better outcome in their health. But it can't hurt just to go to an office and ask some questions and see like what you can do to help. I personally, separately, I do free consultations. Some chiropractors do the same. And if you want to just ask them, call them and ask a question like, hey, can this help? That's one way to figure it out. But I wouldn't say at all to say like, okay, how I can have my care be for chiropractic care versus for physical therapy, because they all work the same. Like, for instance, if someone has knee pain can very well be helped out with physical therapy, and it can well be helped with chiropractic care, but working together, it can make the whole outcome much better for a patient.
Right. I love that. So it's basically building like a care plan essentially and having a whole team behind you. So it doesn't hurt to kind of pick one or both. It sounds like it doesn't hurt to do both at the same time too. So now what sets your practice apart? Like what makes you shine in the chiropractic world compared to others? And what's important to you when it comes to how you treat the patient?
Okay, well, I have seen patients from the age of 3 weeks to 80 years old. So with that very demographic, I can't treat everyone the same. And I am a gentle adjuster, but also can use a little bit of force when need to. But either way, I like to be specific on how I adjust. I'm not at all trying to do the same thing on anybody. I want to give what the patient needs to get them better. So if someone is afraid of certain touches, then I have other bags in my other tricks in my bag that I can do to help them feel better. I'm not one size fits all for all my patients.
Oh, I love that. That's actually quite interesting. So just because one method of treatment works for one person doesn't necessarily mean it will work for the next. And you're willing to accommodate the person based on like their anatomy or their situation or their age or abilities, disabilities, stuff like that.
Yes.
Love it. That's wonderful. And now I know that you are a part of the Chamber of Commerce. I just wanted to talk a little bit about that and what made you want to be included in the chamber.
Well, I realized that Lake Norman is a tight-knitted community, and I definitely wanted to be a part of helping out the help in the people here. With the event I have with them, I'm sponsoring the Women's Conference that's on May 7th. It is a great event. There's going to be some wonderful speakers there, and it's a nice way for women to kind of fellowship with each other. So.
All right. I love that, and it's so great that you are sponsoring that. And then if someone is new to you or chiropractic care or your practice, and if they're in pain and they want to reach out, or if they just want to start creating a care plan for preventative care, what's the best way to find you, to reach out? If you have any promotions going on, what's the best way for someone to get in contact with you?
You can call our office. Our number is 704-360-2675, or you can go to our website. There's a link for you to book an appointment. My website is www.wc-chiro.com. And then right now I do have a promotion from now all up to the end of the month, where it's $59 for the initial visit, exam, and x-rays. I'm doing this because I want to give the people here the opportunity to be able to increase their health without having a barrier where thinking that chiropractic care is too expensive for them.
Of course. And I know that sometimes financial, like medical costs are a burden to people. Do you accept insurance as well?
Right now, I don't take any one private insurance, but one of the main ones I do take is Medicare.
Okay, good to know.
But I do also, have other ways to accommodate for patients.
Okay, good to know. So I thank you so much for joining us this morning, Dr. Roberts. It was such a pleasure to meet you. And again, Dr. Roberts is with We Care Chiropractic. So definitely get in contact with her if you need someone in the area, if you need an adjustment, or if you just want to start prepping for your body care, especially if you are pregnant. And with that is our show for today. So I want to thank y'all for spending your morning with me here on the World Famous Home Ad Show. And I want to thank you, Dr. Roberts, for joining us as well. It was such a pleasure to meet you and get to learn about your practice. And I just want to wish y'all a very, very, very happy, enjoyable, warm weekend. And of course, we are here for you, whether you're buying, selling, or celebrating. Give us a call, 844-STUDIO-4, 844-788-3464. between 9 and 11 a.m. Monday through Friday. If you want to reach us out of hours, give us an email, home@wsicnews.com. Thank you for tuning in and spending your morning with us. Until next time, enjoy your weekend. And remember, there's a reason to smile if you look for it. I love you all and stay wonderful. Bye-bye.
Great radio doesn't end here. Catch